So today we'll be discussing about a very important and very common comparison that is between amlodipine and cilnidipine. Now we know amlodipine is one of the most beautiful drug over the period of history because both these drugs are calcium channel blocker and both these drugs are first line drugs for hypertension almost in all the case scenarios. The dosage for the amlodipine is around 5 to 10 milligram per day, whereas for cilnidipine we can give up to 40 milligram per day. So most of the time cilnidipine is given 10 to 20 milligram per day. But in CKD patients, if the patients very commonly have high blood pressure, so we can give up to 40 milligram per day. Amlodipine is an older drug which is there in the market since so many years. The beauty of these both the drugs is they both are once a day drugs. So most of the time, a single dose at a single time is more than sufficient. Both these drugs are available in dual as well as in triple combination, mostly with telmisartan, metoprolol, or telmisartan and chlorthalidone. So Silacar TC, Nexvos TC, Metexel Trio, such combinations are available, which has either two or total of three drugs. Now, where does these two drugs differ? The most important thing is this ankle edema or pedal edema is significantly present with amlodipine, whereas the occurrence of this pedal edema or leg edema is very less with cilnidipine. So, if any patient is on antihypertensive medicine, suppose if the patient is on amlodipine and if the patients develop pedal edema, I would rather switch that patient from amlodipine to cilnidipine and add a small dose diuretics for a few days. This is the first main difference which differs this amlodipine from cilnidipine. Now, what are the other differences? The second difference is amlodipine very commonly can cause reflex tachycardia, or it can slightly increase the heart rate, whereas the cilnidipine does not cause this reflex tachycardia. In fact, cilnidipine causes reduction in the heart rate. So if any patient who has hypertension, diabetes, and if the patient has a heart rate of suppose more than 80, 90, 100, then I would rather prefer giving cilnidipine instead of giving amlodipine. So more is the heart rate, that will be a bad for heart over a period of years. So there is no reflex tachycardia. So in fact, the cilnidipine causes reduction in the heart rate, but it never causes bradycardia. Patient won't be having bradycardia, or the heart rate won't reduce to less than 60. But the increase in the heart rate will be lesser with the cilnidipine. So if some hypertension patient has heart rate of 100, 110, 120 at the time of onset, we won't be putting that patient on amlodipine, but we would rather prefer to put that patient on cilnidipine. There is one more difference that this amlodipine selectively dilates only afferent glomerular arterioles, which causes actually intraglomerular hypertension, whereas the cilnidipine it dilates both the afferent efferent arterioles of the glomerulus, so it does not produce glomerular hypertension. Along with this, this also suppresses the renin-angiotensin and aldosterone system and thus reducing the oxidative stress. These things puts this cilnidipine at a superior level so that it has a renal protective role over a period of years. So it reduces proteinuria, so it reduces progression of chronic kidney disease over a period of few years. That makes reduction in the heart failure, reduction in the hospitalization due to heart failure in CKD patients. So this benefit is there with cilnidipine, which is not there very well studied in amlodipine. So reduction in the proteinuria, reduction in the CKD progression, reduction in the heart failure in CKD patients, over a period of time. This is much beautiful thing which comes to the cilnidipine. Both these drugs are once a day. Both these drugs are calcium channel blocker. Amlodipine causes more pedal edema, which is not there with cilnidipine. Amlodipine increases the heart rate, whereas cilnidipine can actually help us to slightly reduce the heart rate. It won't increase the heart rate, and a slightly benefit role in the CKD, slightly benefit role in uh, preventing the heart failure, preventing hospitalization due to heart failure in CKD patients, and prevention in CKD progression. These benefits are there with cilnidipine. So this drug can be actually evaluated very well, and this can be preferred in those patients who are already taking amlodipine if these things be considered. Otherwise, any patients who are perfectly normal, who don't have CKD, who are plain hypertension, who don't have any pedal edema, or in spite of amlodipine, if the patient does not get pedal edema, we can simply continue amlodipine because amlodipine is cheaper than cilnidipine. This was all for now, and thank you so much.